is Anthony Chadwick from the Webinar Vet, welcoming you to another VETChat episode. Pleased to have you on, and I'm really honoured and super pleased on this National Pet Dentistry Month to have Annabel McFadzean on with me, who's a veterinary dentist based down in Somerset. So welcome, Annabel.
Hi, thank you for having me.
This podcast is sponsored by Animal Care, distributors of the Plactive Plus range of dental home care products for cats and dogs. Animal Care's Plactive Plus range includes a VOHC approved water additive, malt flavoured toothpaste, easy to use oral spray, and innovative dental wipes. Animal Care also support Pet Dental Health Month, which occurs during February each month. For more information on the Plactive Plus range of products, or to request free campaign materials for Pet Dental Health Month, please email info@animalcare.co.uk. I know when I was at university, certainly was neglected a little bit during the university curriculum. Why do you think, when it's such an area of importance, that that's happening?
I'm always in two minds about the fact that there's a pet dentistry month, actually, because I feel like it should be something that's put in the forefront of people's minds all year round, not just 1 month a year, because it is just such an important aspect of our pet's health. And I think oral care, as you say, can be easily overlooked. It's all hidden inside the mouth. It's much harder for owners, I think, sometimes to appreciate it until it's very advanced. So I really think it should be at the forefront of people's minds the whole year round whenever you're examining any animal, really. Yeah, I agree with you. When I was at university, so I graduated in 2010, and if I did get any dentistry teaching, I can't remember it. So it obviously didn't, it wasn't pretty significant to me at that time. And I still actually can remember the first canine tooth in a dog that I extracted as a new graduate, because I think it was pretty traumatizing, because I really did not know what I was doing, because I just had little to no training. So I think it's a real shame, and I think it's something as a veterinary community, especially as a veterinary dentistry community, that we're really trying to push more in universities, actually. And I think it has come on leaps and bounds since I graduated, and there is much better teaching these days. And I think also as new graduates are going into practice, I do think they have a better appreciation of its importance. So hopefully, slowly, our voice is being heard.
So this is, I think, important. I remember my first couple of years not really having much of an idea of dermatology and pretty much using steroids for everything, which was totally inappropriate at times. And then realising I didn't know anything about it, and that made me go off and do a Royal College certificate. And then I did quite a lot of referrals. So presumably this traumatic experience with the tooth led to you following that road, now, of course, being a diplomat of the European College of Veterinary Dentistry. Perhaps just explain that journey from new grad leaving university, nervous about teeth because apart from your own, you hadn't really examined many, and then ending up doing all this amazing stuff that you do down at Cave Veterinary Specialists.
Yeah, absolutely. I definitely did not just fall into dentistry from the moment I graduated. I detested dentistry in practice when I first qualified. I think it's that, I think naturally we always want to do the best for our patients. And I just felt like I was not doing my best when I was doing dentistry, because it was just this huge area that I didn't have a huge understanding about. I did actively try. I did do lots of CPD at the time as a new graduate. I definitely concentrated on doing dentistry CPD. I think really what got me into it was us getting dental radiography installed into the practice. And I think that happened in about my second or third year in practice, that we had dental radiography installed. And it really kind of opened my eyes, actually, that there's so much more going on than just these white things that you see in the animal's mouth. They are kind of living, functional things, teeth.
Yeah.
And there's so much more to think about than just, do they need to stay in or come out? There's so many more disease processes that they can undergo. And it also made me realise that actually oral pain, I think, in our patients is really hard to appreciate. I often explain to the clients in a consult that if I was sitting here with a bad toothache right now, you wouldn't know about it unless I told you, because there's very rarely external signs unless you're very kind of late on in the process. So I think a lot of our patients, probably do have an element of oral pain, that have dental disease, that we very easily overlook. They don't walk in with an obvious limp or a huge lump on their side or something that's really obvious to see. So I think it's just making it aware that if we're not dealing with dental disease appropriately, we are potentially leaving our patients with a source of oral discomfort, oral pain. So dental X-ray kind of really got me into understanding more about teeth. And I actually did a surgery certificate when I was in practice, and there was a oral surgery component to that. And in collaboration with also getting dental X-ray installed, it just kind of went down the route of teeth and oral surgery, and then that was it. I was addicted. Yeah, and here I am now. Yeah.
I think it's really interesting. You were talking about the oral pain, and quite often when I was in practice, first opinion, they're very satisfying cases, because often they're very easy to diagnose, because, as I was saying, the dog is 10 meters away from you in the reception, and he's walking towards you, and the smell hits you before pretty much anything else does. And you lift up the lid, you can see that, some teeth are just being held in by their tartar. And quite often then I would get, I've actually been to another vet's, but it's an old dog and we're worried about an anaesthetic. It might die during the anaesthetic. And my attitude was always, gosh, if you can imagine how painful these teeth are, it's a welfare issue. So we actually do need to sort this mouth out. Of course, there is a risk of losing, the dog, the cat, under an anaesthetic, but actually that's quite rare. And usually actually the opposite happens.
Yeah.
You see the dog a week later and it trots into the consulting room, and the owners say, "Oh my goodness, this is a miracle. Have you taken 5 years off my dog's life? Because he's back to where he was 5 years ago." So they are incredibly, they were incredibly satisfying cases, but you actually don't appreciate it fully until, like myself, during the pandemic, I had really bad tooth pain, and actually had to have, because of the pandemic, an emergency tooth removal, which immediately then, released the pain almost, within 24 hours. So tooth pain is painful.
I've had it as well. It's just awful, isn't it? It's just there all the time. You just
Yeah.
cannot get rid of it. It's just horrendous.
And not being able to sleep because it was throbbing, you were having the paracetamol, it wasn't really doing anything about it. So do you still see that way? You're having cases referred to you and you think, why were people not maybe taking action sooner? Is it becoming because it's a desperation then, or what's the sort of range of referral things that you see, and perhaps what are the ones that you're at the point where you say, gosh, with some more education, perhaps vets in practice should be doing these? I was always, as a dermatologist, thinking I shouldn't see scabies cases, but I would see them, and that was obviously more of a diagnostic thing. But yeah, any thoughts on that?
Yeah, I think some of the cases that often get overlooked are kind of traumatic dental injuries. So, you can have dogs that have beautiful periodontal health and their gums are very healthy. And so they're just kind of overlooked as like, oh, they've got great teeth, and, you're not really having a proper oral examination. But no, actually, if they've got a broken tooth, and for example, like a maxillary carnassial tooth, the fourth premolar, is a classic one that gets fractured from chewing really hard objects or hard bones. They can just be left for quite a long time, really, until sometimes the dog presents with a draining fistula, through its face. And actually they're presented because they have a swelling on their face and they're being investigated for a foreign body, and they're being referred because they think they've got a grass seed. But what they fail to realise is if they just lifted the lip up and had a look in the mouth, the tooth has got a huge fracture through it. So I think it's just understanding. Yes, I agree there is a limitation to conscious oral examination. You definitely cannot do a comprehensive oral examination conscious, but at least always doing an oral examination as part of any of your overall general health check of a patient. And if there's any indication that there's any oral disease at that time, then recommending to the client that you do an anaesthetised exam so you can have a comprehensive look.
Yeah.
And it's really common actually in referral that you get referred for one thing, and actually once you anaesthetise them and do an oral exam, you find 15 other things. It's not uncommon at all. It's really kind of understanding that to really get a really good look at the mouth, you have to anaesthetise your patient really to be able to look. And the importance of dental radiography as well. I think it's becoming more and more the norm to have dental radiography facilities available, but just understanding how much that can elevate your potential to diagnose things and be able to recommend treatment options to your client as well. And whether that's things you do in-house or whether you refer, but at least then you're able to give the client kind of the full information.
No, that's great, Annabelle. Um, I think I was probably a bit like you when I qualified. Dentistry did hold some terrors, particularly because at that stage we were using hacksaws to cut teeth and things. So I didn't actually have a dental machine in the first few practices, which were quite rural. And then I got my own practice. Actually, went on a few dental practical courses, which is, it's fine to know all the theory, but there's a lot of practical skills, how to hold the instruments, etc., isn't there?
There's some great practical courses these days, actually. And I think actually just watching someone do a surgical extraction well, and doing oral surgery well and understanding what you can do, for me was really eye-opening. So I think if you are able to go on a practical dentistry course, they are fantastic.
And have one of these fancy dental machines, because hacksaws, whilst they build your muscles up, they end up you're taking 3 hours to do a dental, and I don't think it's particularly fair on the dog either. I'm presuming you don't see any hacksaw injuries anymore now.
No, not anymore.
Yes, we've definitely moved on, which is definitely for the good as well. One of the other things, and I know this has moved on, but I'd love to get your opinion on your approach to this. You get a dog in, the common sort of Yorkie that's not been looked after. Its mouth is disgusting. There's 20 teeth that are hanging on in there, because of the tartar around them. You take the tartar off, you remove all these teeth. The majority are pretty easy to remove. Obviously, some pain relief, but there's always a temptation. And I think I was actually quite good at using antibiotics sparingly, but I always felt, because of that mouth, one of the things I used to say to clients was, if the mouth is like that oral health, that bacterial load in the mouth can obviously spread into the heart, into the kidneys and so on. So I always felt it was appropriate even to give antibiotics a few days before and maybe for a few days after. But I think that is, again, from an evidence-based perspective, it's going out of vogue. So where are you in that whole use of antibiotics and antibiotic stewardship within the dental space?
I think these days actually the indications for using antibiotics in our patients is very few.
Yeah.
I rarely dispense antibiotics apart from a very few specific cases. We know a lot now, and we know that the bacteria in the mouth in periodontal disease survives within a biofilm within the plaque. So we know that actually systemic antibiotics is really not going to do anything, and actually taking those teeth out, that have advanced periodontal disease is what we need to do to reduce that bacterial load. There are certain cases that I will use antibiotics in. So if there's any significant cellulitis associated with like an endodontic infection or something quite advanced, any kind of fistula formation like through the skin, and certain comorbidities as well are indicated for antibiotic use. So I think subaortic stenosis, a cat with FIV potentially that had a very long procedure. So there are certain indications, but they are few and far between. So it's absolutely not a routine thing for me to dispense antibiotics for our patients.
And then also, having removed a lot of teeth, again, I always felt, drainage was important. So I didn't tend to stitch, the sockets over. But of course, that now seems to be very much.
I definitely close every single extraction site. So even incisors, everything gets closed. And what we're trying to do there is we're trying to hold the blood clot into the socket so that it doesn't get lost, because we know that's what's going to help it heal the quickest. And actually, I myself had a tooth extraction, and in people, I don't think they routinely close them. And I lost the blood clot and I got alveolar osteitis or dry socket. Oh, it was like the worst thing I've ever been through. It was so painful. So I'm just really conscious of making sure that I close all my extraction sites really well to
Yeah.
hold that blood clot in and allow it to heal.
Because as you say, those dry sockets can become necrotic and things and painful, can't they?
Yeah, they're really painful, really sore. And again, I think, as we said at the beginning, oral pain is so difficult to appreciate in our patients. So I want to make sure that I'm doing everything I can to reduce the risk that I'm leaving my patient with any discomfort.
And one of the questions, and I think we've covered it a little bit, is very much what are those skills? I think you've mentioned vet radiography. What are the skills that vets and nurses, maybe in general practice, with your knowledge of what you see coming through the door as a referral? What are those things that perhaps, as well as radiography, vets and nurses maybe could be doing better in practice?
Yeah, so radiography is definitely number one.
Yeah,
I think that you definitely need to practice, but you can get pretty good quite quickly with practice. And, definitely there's a learning curve and we all have to go through it. But being able to get some really good quality dental radiographs is not difficult. And the nurses, can do that really well as
yeah,
well. And also interpretation of dental radiography is good. I think the second one, probably that I think that everyone should be doing in general practice, is local anaesthesia blocks as well for their dentistry cases, because they're so simple to do, and there are some really good practical courses you can go on, and lots of kind of online webinars and things about
yeah,
local blocks, and they can not only provide you with great analgesia during your procedure, but also post-operatively as well. So I think there's no excuse really to not learn how to do those and perform some local blocks when you're doing treatment on your patients.
and the benefit, I suppose, is that the dog is asleep when they're done because as a patient, seeing the dentist approach me with a very long needle, wanting to jab them into my gums, is one of those unpleasant parts of going to the dentist, isn't it?
Yeah, I know, but we all know what it feels like when they wear off, and
Yeah,
suddenly you start to feel it. So
yeah,
if you can imagine that our patients, if they can have that numbing effect for as long as possible, that's great.
yeah.
Yeah.
But almost better than the just giving non-steroidals or paracetamol, I presume.
Yeah, definitely. We send our patients home with that as well, for kind of
Yeah.
more long-term analgesia. But yeah, in that kind of acute stage, if you can have some local anaesthetic on board, that's great.
Well, obviously, I know you're not at this potentially part of the procedure, but that whole area of home care.
Hmm.
Obviously, we've got various biscuits like TD and various biscuits like that. Um, Obviously, we've got toothpaste, all this range of Placative Plus as well that Animal Care have brought out. So, where do you see all of that fitting in, and is that appropriate and realistic that people in their busy lives are going to do all those things?
Yeah, I mean, home care is vitally important, really, for maintaining oral health. In a gold standard world, which we do not live in, I appreciate, these patients should be having kind of annual professional dental cleaning and then year long kind of home care, really.
Yeah,
The studies show that toothbrushing is definitely the most effective. So it's about 3 times more effective if you do it every day compared to
yeah,
dental chews and dental diets. It doesn't mean that other products don't have their place. Of course they do, but we know that toothbrushing is the most effective. But it does have to be done every day, as a bare minimum every other day. Anything less than that, then it's not statistically significant that shows improvement. So it does have to be something that you make part of your animal's kind of daily routine. We really try and talk to people in general practice about introducing this in puppies and kittens, and actually the role of kind of the nurse in a kind of puppy and kitten check, talking about oral care and home care from the outset is the best way, because it's much easier to introduce it, obviously in a young patient than it is when they're a bit older. So again, I think it's just practices having a kind of one voice approach, everyone kind of singing from the same hymn sheet and giving the same message to clients. And I think that's the best way that you're going to gain client compliance, really, and trust, and kind of doing that ongoing. But yeah, toothbrushing is the way to go.
you took the words out of my mouth. The importance of the veterinary nurse.
Hmm.
And I think also for me, I always pushed it in my, consults, puppy, first and second vaccines, because doing it very early on, the dog gets used to you getting hold of its muzzle, lifting its muzzle, being able to brush its teeth, making it easier to give tablets and so on. They're more likely to turn out a well-adjusted pup or kittens, and if
Yeah.
you're not doing those things.
Also makes my life easier when I'm trying to do oral examinations and they're older as well, because if they're used to having their mouth examined, then yeah, it makes my life easy. So
No, absolutely. So maybe just finishing off with cats.
yeah.
Do you see, your workload, presumably mostly dogs and cats, maybe an occasional rabbit thrown in for the fun of it, but what would you see percentage wise, cats to dogs?
I probably see about 50-50, I'd say. I think compared to the other departments within the hospital I work in, I definitely see more cats as a percentage. I think probably a lot of that is tooth resorption cases, especially practices that don't have dental radiography available, I think are offering referral for tooth resorption cases just because of people understanding more now that how important it is in treatment planning for these cats. So yeah, I do see a lot of cats actually. I quite enjoy feline dentistry, so I'm not
Yeah.
complaining.
And would it as you say, mainly be tooth resorption? What are the other things that you would tend to see? Presumably some fractured jaws.
Yeah, fractured teeth, feline chronic gingivitis stomatitis is a common
Yeah,
referral for cats. I think it's such a difficult disease process to manage, so they are often referral cases. So I'd say probably they're the most common. Yeah, jaw fractures now and again. Definitely, we get jaw fractures in cats. Tend to be kind of road traffic accidents or sometimes iatrogenic, during
yeah.
extractions. And I think dogs are more kind of dog fights or things like that. But yeah, we do see that as well.
And that's such a horrible disease because of the pain that you see the cat in, that sort of whole head and neck, which I saw also with dermatology.
Mm.
Cats can really kind of overreact to pain almost, can't they, when they get these severe stomatitis?
Again, I think it's one or the other way. I mean, some cats, yeah, I mean, they present. If, for example, like gingivitis stomatitis cases, I see as urgent cases. They're often referred as routine, and I just don't think they're routine. I think they need to be seen as soon as possible because often these cats are in severe chronic pain. But equally, I have cats with horrendous generalized periodontitis or tooth resorption that you wouldn't know. Like they're still eating and happy, and
Yeah.
they're still kind of just crack on with it really. So yeah, we definitely see a variety of cases.
You definitely see, I think, cases where removing teeth is almost curative, but with some you still need to carry on, particularly sort of, you're still seeing a bit of FIV and FELV, well, FIV, I think, mainly causing stomatitis. Is that still
Yeah,
challenging?
we definitely always check FELV and FIV status when we have a cat with chronic gingival stomatitis.
Yeah.
It doesn't change our treatment plan very often. We still make the same recommendations, but sometimes it can just affect prognosis, or it may be that they just take a bit longer to kind of recover from the surgery. So it's definitely important to check that status in those patients.
I remember when we did our first ever webinar series, the year you qualified, 2010, we did a big series with Hills.
Yeah.
And there was a competition, it was all feline, and there was a competition of, what was the most common disease, dermatological diseases, orthopedic diseases, or dental diseases. And I think in the end, I always thought you were going to say dental, but of course it was orthopedic because of the amount of arthritis that
Okay.
cats get.
Yeah.
But dental disease is obviously such a big problem. I agree with you that it needs to be a concentration point for the whole year around. But I do appreciate you coming on in this month of Dental Health Month.
Absolutely.
Also, thanks to the sponsorship of Animal Care, it's been great to chat to you and pick up on some of those tips. So definitely, if I go back out into practice again, it's looking out for radiograph machines X-ray machines to help us with the diagnosis. Because as you say, the disease isn't always on the surface. The roots can be the problem as well, can't they?
Yeah. The roots are the root of the problem.
Uh, Annabelle, thank you so much for coming on. I've really appreciated chatting to you, and
You're very
yeah,
welcome. No, it's been great. Thank you very much.
and thanks so much also to Animal Care, the makers of Plactive Plus. Do go on, and we'll leave details under the podcast so that you can email or reach out to Animal Care if you want to hear more about their range of dental care treatments, prophylactic preparations. So thank you once again, Annabelle. Thanks everyone for listening. Hope to see you on a podcast or a webinar very soon. Take care. Bye-bye.